All right. Hello, everyone. It's just about 2 o'clock. Sure is. Hi, everyone. Thanks for joining. Welcome. Let me see if I could pull up some screens here for us. Trying to be a little fancier this month, but welcome. It's the third Saturday of the new year. And as you know, the third Saturday of the month, we host the WTYL program. So, welcome. Hopefully, I can get my slides to cooperate with us. But I am excited for the new year. I'm excited for you guys to be joining me and for us to create programs. Welcome, everyone. And thanks for stopping and watching. We are having a web chat for young Lupians. Perhaps you're a patient or a caregiver out there looking for fun ways to engage with kids, or you're just looking to create fun things to do with your kids. This program is all about the kids, our future leaders. And so I am so happy for you guys to join. Follow along with me for a fun little topic we're going to discuss this afternoon. And hopefully I can make my slides work with me, so bear with me here. Yep, I'm already going the wrong direction. It's all good. I'm so pleased to be here today and chat with you. Hi, I'm Leslie Viscara-Tierney. I'm the Vice President of Operations for the Lupus Foundation of America Greater Ohio chapter. The chapter looks for fun ways to empower and support young lupus patients. And so each month we post a live chat to work toward that goal. And it's fitting to talk about the new year right now and setting some goals and maybe looking into thinking about your New Year's resolution. Perhaps you're already into it. Maybe you already have your New Year's resolution set. But we just want to take a little bit of time and reflect on our thoughts. So I want to help you try to create some goals here. So let's see. All right. Well, first off, I want to check in with all of you. Really, I want to know, how are you? First off, it really, I mean it. I want to know what's going on. It's been so long since I've seen everyone. I think about everyone that I'm missing seeing. It has been a while since we've hosted events like the Walk on Lupus now in person, the Zumbathons, Dancing with the Stars, in-person educational programs. It has been some time. This past year, I know for me and a lot of people out there, has been difficult. It's been especially difficult for lupus patients and the medical community. I don't know anyone that hasn't been affected or impacted by the pandemic. And, we're in this together. We really are. So I'm thinking about you guys, but we have to stay together. Together we are really stronger. So these little programs are here to help just connect with one another, but we really are looking forward to getting back into person real soon. And so, I'm sure you or your parents have put in a call to your rheumatologist office to try to sort out, if you're having symptoms of a flare, or is this symptoms of COVID, or is this symptoms of a flu. We all have a lot of questions right now. And it can be quite scary not knowing, trying to figure out what's going on. But I want to tell you, it's okay and it's good to reach out to your healthcare provider. Checking in and making sure you're on the right path with treatment and that the treatment is safe and is really responsible of you and your caregivers. Reaching out to your physician will give you the confidence to knowing you're receiving the best help and treatment. So whenever in doubt, reach out. That's going to be my new motto right now. Don't second guess if you should be doing something or talking to family and friends about things that you're going through. Talk to your rheumatologist. Check in with your healthcare provider. If you ever need someone to chat with, you can always call the Lupus Foundation. You can call the chapter. Let me go ahead and put up our number there. But you can connect with a patient navigator anytime. We'd be happy to connect you with one. But of course, I'm always happy to chat with you one-on-one too. You can email the office anytime. You can call the office anytime. Just keep in mind the office hours are Monday through Friday, 8 to 5. But I'd be happy to arrange a patient navigator to check in with you outside those normal business hours. We do have patient navigators around the clock. So when we ask, how are you? I really do mean it. I want to check in. I want to know what's going on with everyone. And we can connect with you outside of social media platforms. I mean, you can message us on Facebook or YouTube, and we'll try our best to get back to you right away. But really, the best way to reach out to the chapter is to pick up the phone and call or send us an email so we can schedule a chat together. So I just want to know how you guys are doing. We have services that we want to provide you guys, and reach out. And when in doubt, reach out, call your physician or your rheumatologist about things that are going on. So we're still in the pandemic. Things can be a little scary, but it doesn't need to be. And I know our healthcare system is overburdened with a lot of things that are going on, but it's best to just pick up the phone, send the email out, and get connected and get the answers that you guys need. And it's okay. I want to tell you, it's okay to do that. So that's kind of my special message about just everything that's happening with the pandemic that we're going through. And everyone's, we're in this together. And I really wanted to reiterate how important that is. So, okay, today's topic. We pick a special topic, and I try to get your insight out there. So if you ever have a special topic you guys want us to talk about, message us anytime. I still have our information and at the bottom, and I guess I'll keep it up for a little bit there. But okay, today's topic is setting New Year's resolution goals. So as I was writing out this program and trying to think about things to chat with you guys about, I was thinking, do people still set New Year's resolutions? And I think they do. I do for myself. I know. It gives me kind of a benchmark. But also, why do people set New Year's resolutions? So this was just something I wanted to think about and want you to think about, some food for thought. Maybe you already have yours out there. If you have it, comment below and let me know what yours is. But for me, I think setting a New Year's resolution is a way for you to check in and be sure you're becoming the person you want to be, right? And it gives you kind of motivation. It gives you motivation when you think about it. It does, setting goals. It gives you time to grow and to make change. It's really important for us to grow and make change. If you think about it and you want to change something in your life, getting steps, and that's what we're going to talk about, the steps to do that and recognize where you want to grow and change. Maybe you want to take some fun and take some time and start painting. Or maybe you want to spend more time with your family and do more cooking together. You want to play a musical instrument. Or maybe you want to take some time and work on mental health and a little R&R. And those are good things to think about, right? So let's see. I feel the first step to setting your New Year's resolution is I want you to look back at the past year, right? But looking back at the past year with kindness and compassion. So it's real easy for us to be Debbie Downers and think about all the bad things that are happened, and I think that's easy to do because negative things tend to leave a little lasting impression for all of us. They kind of, bad things that happen, they sting a little bit. So it's so close to the surface. But when you look at the past year, really be open-minded and think about giving yourself kindness and compassion. I really think that's important. So, really when you think about the past year, because it's been difficult for everyone, you need to be open-minded and reflect on the things that you enjoyed. What did you really like this past year? And maybe you could think of doing more of that. And maybe that'll inspire you for you to spend more time with family and friends. So really be compassionate to yourself. But think about the past year. Was it something that you enjoyed? Maybe is it something that just didn't feel right and you want to make changes? Think about those things that you want to do. So really look at the past year to see where you can set the new year to go to, okay? So looking back at the past year, let me see if I can fix up my screen a little bit. I want to hide that now. All right. The second step here is to set an intention. By setting an intention, we'll give you a general idea of what you want to accomplish, like learning something new, being more healthy, finding better health, working on your mental health. And maybe it could be something being kind to others. That's super important, right? The world could all use a little bit of kindness, and if we set that intention out there, I think it'll have the ripple effect. It'll get catchy. But speaking of mental health, it's so important. I wanted to share with you some really awesome things, some awesome news that the Lupus Foundation of America Greater Ohio chapter is working on. We're actually working on a partnership with BetterHelp. They are a comprehensive mental health program, and they can connect you with a personal mental health therapist, which is super awesome. And it's to help you manage your mental health. We are working out a negotiation of providing 2 months free, a package of 2 months free of mental health services. Now, this is for lupus patients and caregivers in the state of Ohio. So if you're out there in a different state, sorry, this is for the Greater Ohio chapter, and so we really want to touch base with people in Ohio and help serve them. If you're in a different state, maybe you could reach out to your local chapter and see if they can provide and offer services like this as well. So, and a lot of other chapters are doing something similar to this. And if you have questions about that, if you're in a different state, just let me know. So really awesome. We're working on, if mental health is something you want to focus in on this year, we are offering 2 months free for you to work with BetterHelp and a licensed therapist. So I think that's pretty cool. And maybe mental health is just something that we all need to focus in on. I know I could use a little bit of support in that area sometimes. It's been a difficult year for all of us. But if you think it would be a good idea for you to do this, if you want to start on a mental health journey, go ahead and contact us. I guess I'll pop up our information there again, and we'll set you up we'll let you know how to get involved. But sending an email would definitely prompt us. We're going to have 2 months free mental health specialists working with you, and I'm excited about the program. So again, we're thinking about New Year's resolutions and setting the intentions. Maybe mental health is something you want to work on. Maybe not. Maybe not though. So, okay, my third thing is, these are really small things to think about. I didn't want to make it too complicated at all. But maybe to work on these goals and everything, when you set the intentions, think of the past year, making small steps to achieve what you're working on. Because when you make small steps to change, you're more likely to really hone into that and grab onto it. Don't make it so difficult. Don't be hard on yourself. You should be your biggest cheerleader for sure. So give yourself some time. Don't be too hard on yourself. Really think about how much you can take on. Like if eating healthy is your goal, great. Give yourself room to still enjoy some of the things that you really like. Maybe chocolate is your thing, and you can't just completely cut that out of your life. P.S. Dark chocolate is a great antioxidant for lupus patients and for everyone. And antioxidants are great because it helps patients reduce inflammation. So maybe it's about adjusting that sweet tooth of yours. So don't be so hard on yourself. Give yourself time to make small changes. And that's really the message here today. The 3 things we want you to do is reflect on the year, make an intention, and then make small changes. It doesn't have to be that difficult, okay? So I hope you guys are thinking about New Year's resolutions, because I think it's a great way for growth. It's a great way to show change. And for me, it gives me time to think in and say, is this who I want to be? Is this how I want to be remembered? And maybe it was a tough year and you just need to get back on track like me. And I'm going to get back on track and set up some personal time for myself. That's my New Year's resolution. And I think it'll make me happier and more well-rounded. And so I Wonder what your resolutions are out there. If you want to share with us, go ahead and comment. If you want to work with a patient navigator and talk with anyone in our chapter, feel free to contact us, okay? And so let's see here. It was lovely spending time with you guys. You know, I'm around the third Saturday of every month. I come join on Facebook and YouTube to come chat with all of you. We have a lot of services within the chapter right now. Let's see, do I have our Lupus website is, you can visit our website. Let me show this too. For more information, if you're looking to get into services with mental health specialists, you know, check out our website periodically. The best way to do that is to sign up for our newsletter so that when those things come available, you'll be the first ones to know. So visit lupusgreaterohio.org for more information on that. Sign up for the newsletter because when the services for mental health come out, we'll definitely get that out to you. We're actually working on a medication assistance program as well. And we're also looking to help patients get on Uber health rides. So if you need help getting to your doctor's appointments or a specialist, we're working on being able to provide some help with that. Of course, these resources are limited. So I'm sure when we market it out there, you know, check your newsletter and be sure to jump on it. But I wanted to give you guys the first to know. So if you're chiming into the WTYL program, you're hearing it here first before we email it out to everyone. So it's coming pretty soon here. All right. And so that'll be about it here. So I just want to thank you guys for joining the WTYL chat. And I look forward to seeing you next month. I do have a calendar already scheduled out for the year, but if there's a topic you want to learn about, if there's a topic you want to talk about, you know, I'm open to receiving that. Go ahead and message the chapter. I will tell you, I spent a little bit of time at Metro Health Hospital in the pediatric rheumatology unit, and it was a wonderful experience. The physicians there were great. The medical staff was great. They have great patient assistance personnel, and they were there to really make patients feel really comfortable within the facility, and I think that's wonderful. So, you know, if you guys know anyone out there in the medical field, right now is a great time to say hello and thank you to them. But Metro Health Hospital is really doing a great job. I haven't had the pleasure of visiting facilities around here in their pediatric rheumatology department, but I'm sure they're just as great, or Cleveland Clinic. I haven't had quite the opportunity to check out with them. But I know a few younger kids were getting infusions for their treatment of lupus, and it was just really nice to see you know, some friendly faces and make some friends there. So if you guys were tuning in to the WTYL program and I met you over the last week, I welcome you. I want you to engage with us and give us some topics we can all chat about. But definitely, you know, this year is going to be a better year. We're setting our intentions with our New Year's resolution, and hopefully you liked our little chat. But we're here for you guys. So, you know, I talked about a lot over this last 30 minutes or so. If you need any help, 20 minutes or so, be sure to reach out to the office. Again, I'm Leslie. I am the lead patient navigator for the chapter, and I can help connect you with a local patient navigator in the state of Ohio if you're interested to work with someone. But yeah, with that said, it was a great Saturday afternoon with you, and I look forward to seeing you next month. Take care, everyone. Bye.